to be a part of Essentia Health, which as an organization has the same strategic vision and values that I hold dear. Rural areas, we tend not to have as many resources as the big metro areas, but we have something that metro areas don't have. And especially in rural Minnesota, there is a deep sense of commitment to community and to being a good neighbor. And so being a part of this organization here fits very well with my past experience. It gives me an opportunity for professional growth. I was the chief administrative officer in Austin at that medical center. This is a larger organization in this central region, headquartered, of course, in Brainerd at St. Joe's Hospital. Two organizations that I'm now officially on the local Brainerd Lakes Chamber Board, and we had our first meeting this week, and it's a great group. In fact, I shared with the board members that this particular chamber is famous throughout the entire state as being incredibly active and incredibly large for the size of this. And the other organization is the Rotary. Now I've filled out the application, so I have to wait and see if there's different ways you can look at competition. One way to look at it is as really an opportunity for the community to have some choice, and frankly to really encourage organizations to provide the very best care, including service to the community. Is going through tremendous change, and even Mayo Clinic is a part of that change and making improvements. And so my passion within the Mayo system was, especially in the last, I'd say, 5 years, was really around this concept of the triple aim. And for those who aren't familiar with that, it's really a focus that came out of the Institute for Healthcare Improvement, led by a fellow by the name of Dr. Don Berwick. But it's a focus on the patient experience, population health, and better managing the total cost. But looking at that as three goals that, when you focus on them, actually create tension, because you can optimize one and sub-optimize the other. And so how do you bring all that together? And actually Essentia has embraced the triple aim, patient-centered medical home, and is further along, frankly, than many of the major medical systems in the state will be doing. If we can help people stay healthier, we can use the scarce resources we have for the people who really need it.
So we love biking as a family. We do biking together. We garden. We do a lot of gardening. Downhill skiing, cross-country skiing.
We've never snowmobiled before, but we get the sense that we might try that this year.
I think so. Everybody tells us there's these wonderful hiking areas and parks. So.
Yeah, for us, Minnesota had ended at the Twin Cities, so we have this whole undiscovered territory.
Yeah, it's a new playground for us.
We're people of faith, so it's wonderful to see a faith community that's vibrant, very alive and well in this area. We look forward to joining a church, being involved in that as well.
Where did you grow up?
Well, Rhoda?
I grew up in Indiana. Adam grew up in Boston.
We are a bit different that way.
Yeah. So I'm a Midwestern girl through and through, for the most part.
And I fell in love with a Midwestern girl, and I've also fallen in love with the Midwest, which is good. Well, our impression has been, this, I shouldn't say this on the video, but, it's been a long winter. and we didn't really have a spring, did we? No. But we've heard from reliable sources that there normally is a spring, and the winter usually is long done before May.
Right.
Right.